The Minister of Health, Kwabena Kando, has addressed the press regarding a recent incident at Ridge Hospital where health professionals were physically attacked. The minister condemned the attack and emphasized that nobody, regardless of their status in society, has the right to attack health professionals in Ghana. The minister highlighted the government's commitment to improving the health sector, including initiatives such as free primary health care, prompt payment of national health insurance claims, and retaining health facilities. The government is also working to employ health professionals who have completed school and are currently sitting at home. Meanwhile, a committee has been constituted to look into the post-basic specialist program, including representatives from the Ghana Nurses and Midwives College of the Nursing and Midwifery Council. The minister further said that they have constituted a committee to investigate the incident at Ridge Hospital, which includes a lawyer, a nurse, a medical doctor, an auditor, and an HR person. The committee will look into the matter and make recommendations for implementation. The minister condemned the physical attack on health professionals and emphasized such incidents will not be tolerated. He highlighted the necessary steps government is taking to ensure that health professionals are safe and protected while working at health facilities. The minister's statement highlights the government's commitment to improving the health sector and protecting health professionals. The investigation into the Ridge Hospital incident will help identify the causes of the attack and prevent similar incidents in the future.
That occurred at Ridge Hospital. On Monday morning, I sent a delegation to Ridge Hospital to ascertain the situation. When the delegation came up upon debriefing, I realized that I had to follow up. And ladies and gentlemen, let me state this, that I have the health workers of this country at heart. And so any attempt by any individual or any group of people to try to incite the health professionals against government, pretending he cares more than us, is unfortunate. And we must stop that. It's an avoidable tension we must avoid. It doesn't help the sector. If indeed you are a practicing health professional in the sector, it doesn't help the sector. And so, when the delegation came back, I had to follow up. I was in a company with the Deputy Director General and other directors of the ministry. We joined the medical superintendent at the Ridge Hospital, and I visited the victims. After going around, we had a closed-door meeting to discuss the issues, not insults. One, how to look at beefing on the internal security, staffing issues. So, after the closed-door meeting, I came out to address the press to categorically condemn the physical attack. And that is the most important aspect. And for me, let me at this point reiterate to the whole country that irrespective of the level of provocation at any health facility in this country, nobody, irrespective of your status in society, absolutely nobody has the right to attack any health professional in this country. That is the gravamen of the issue. No diversionary tactics about handshaking. That is what we must concentrate on, to send a clear signal that our health professionals working at the various health facilities are safe. And so, after the engagement with the management, when I pulled out of the ward, then, in fact, in the engagement with the management, I made it clear to them that I had listened to their side of the story. And therefore, as a minister, I will also listen to the other side of the story. And I then constituted a committee to look into the matter, break out recommendations for implementation. A lawyer, a nurse, a medical doctor, an auditor, an HR person to go into the matter. Now, when I pulled out, my attention was drawn to a gentleman called Ralph, who was at the center of the controversy. And so he was working towards us as a group. The medical director was with me, the deputy director general was also with me. Then I asked, why did you do this, gentleman? When I asked, most of you were there. I mean, the press, you were there. So you can attest to what I'm saying. You were there with me. When I asked him, the gentleman then stretched his hand, shaking me, and tried to whisper something into my ears. Ladies and gentlemen, at this point, should I push the guy that don't whisper